Welcome to a very special edition of Dialogue with the Dean. I am John Hartley, Director of Communication and Marketing for Virtua Health College of Rowan University, and I'm here with our usual host, Dean Richard Jermyn. For this very special edition of the vodcast, Dean Jermyn will be switching roles from interviewer to interviewee. This change in roles is apropos as we are here to discuss his new position, Vice Chancellor of Virtua Health College of Medicine and Life Sciences, which unites Rowan-Virtua School of Osteopathic Medicine, Rowan-Virtua Salva School of Nursing and Health Professions, and Rowan-Virtua School of Translational, Biomedical, Engineering and Sciences under his leadership. Dr. Jermyn, congratulations on your expanded role as Vice Chancellor of Virtua Health College.
Thank you very much for that. I'm amazingly humbled to take on this role, Jonathan.
So, to begin, what do you see as the most promising opportunities for the three schools united under VHC?
I think the word is united, right? I think our strongest opportunities are taking three great, amazing schools and bringing them together, not only with shared resources, but shared experience. We have some of the best faculty and staff in the profession, between the medical school, our Translational Biomedical and Science and Engineering program, and the Reed and Larry School of Nursing. I am bringing everyone together. Now I want to say, and I should have said a couple seconds ago, I'm not used to this. I'm the one that asks questions, right? So this is really awkward for me. But it's the word is united, right? And I remember the first day we brought nurses on to our Stratford campus. And people were like, what's this going to be like? I loved it. It changed, just bringing in a new student changed the culture of who we were on campus for the better. And now we're really just highlighting what we've been doing. And we're going to take that culture, and now we're bringing a PA school in our Sewell location. So with growth comes these amazing opportunities, but I'm going to say it again, it comes with being united.
So under your leadership, Rowan-Virtua SOM has seen record enrollment growth and expanded academic pathways. What strategies led to that success, and how do you plan to apply them more broadly in the Virtua Health College?
So everyone's heard me say this before, I'll say it again. It starts with mission. Absolutely starts with mission. I think when I think about the changes that we've gone through over the last year, and people ask me this question all the time, I go to dean's conferences and throughout the country, and people come to me and they say, we want to be you, what is the magic sauce? And the magic sauce for me, as dean and now as vice chancellor, is to understand and know who you are, right? And the fundamental part of that, Jonathan, is to know your mission and who we are as people. We have three great missions, right? One, excellence in education, check. Excellence in research, check. And then excellence in patient care, check. So we know what we strive to be. The other is the foundation of bringing in learners that, one, get our mission and understand that I want to bring in people from diverse backgrounds so that they learn from each other. And you start with different professions. This brings in the best research. It brings in the best nursing candidate, the best osteopathic medical student, and now the best PA candidate, because they want to come in and be part of this. Now here's the other thing. We treat the underserved. We're in communities. And again, we know who we are. So once you know that, people that are drawn to us not because of we have a shiny web page, right? They're drawn to us because they get our mission, and they're the ones who stay. So that to me is the foundation, that is the glue that'll keep all three of these colleges together under Virtua Health College, right? And will allow us to keep expanding. Every decision I make as dean and now as vice chancellor is always about how will this affect our mission, period.
Students, as you've said, students are at the heart of Virtual Health College's mission. How are you working to enhance their educational experience, support their success, and prepare them for the evolving healthcare landscape?
So, big question. So I want to thank you for saying, and I've said it, we exist because of our students, right? Let's start that as the foundation. The entire school, not only Virtual Health College, but Rowan University, we exist because of students. And we exist, and when we think about them as the foundation of who we are, I think of them even more than that, because they make us better and they make us move to the next level, right? I can't do the research that I do. We can't be out in vulnerable communities and doing all the great stuff that bring our students here without them. I have an army of students that are out there saying, Dr. Jermyn, what can I do to help every single day? That's who we bring here. This amazing group of people that are mission driven. And the people that are not, don't come here. They don't choose to come here. And I'm fine with that. So to get back to what can we do to support them? I think first thing is to recognize who they are, and to recognize that when I look at my class and I bring in students of diverse background, I want them to know that they belong here. Every single person has earned their seat here, which is not an easy seat to earn, I may add. You've earned it, right? You're part of our future. We don't bring people here that can't make it. We bring people here, and it's our job. The minute that you're accepted here, it's our job to make sure we're getting you through graduation and getting you into great careers. So that's the beginning part. I also want the opportunity for students to realize that you have the best faculty that you can have right here in our schools. The best faculty, the most committed. I'm humbled when I meet with our faculty and all of our colleges who turn around and say, I'm here because of them. And so I need our students to feel supported. I need you to know that the faculty are here because they support you. There's a lot of challenges, Jonathan. We've got financial challenges. We have challenges in to be honest, space even on campus, right? We have environmental challenges in that way. But the first thing I did when I became dean was I made sure that every student had access to mental health, because I realized that the student has the least ability to control the environment that they're in right now. It's my job to make sure that we provide that for them. So mental health, I opened up to everybody, immediate, free. If you're struggling, I want to make sure that students have access to it. Two, I recognize that medical schools, nursing schools, allied health professions, PA schools, and research schools can be a food desert. So I recognize that it's my responsibility. We could bring you in, but if you have no food to eat, how are you going to do well? So it's my responsibility to make sure that we provide resources, even basic resources like that, to our students. So we have food banks that are right here. We have several grants, Jonathan, as you know, and you've been helpful with that, where we make sure that we will never have an empty food storage here. So students should have the ability to not even ask a question, go, and if you require food. So I hate to say that some of our students don't have these basic needs met. We recognize that some of them don't. And it's our job to make sure that we provide that. On top of that, a world-class education. That's our job. Curriculums change constantly, and we will make sure that we're on top of that. We have degrees that are changing. Look at the environment. A few years ago, you never heard of AI. Now there's degrees. I mean, quite frankly, you can't go anywhere without seeing a degree in AI these days. What do we need to do to make sure that we're providing that curricular change to our students? We have to stay one step ahead of it, right? So what do my students need? Not only to graduate, but to go into the next phase of their career. We're responsible for that too. That's what makes us a little bit different.
So we know that there is a shortage of physicians, nurses, and healthcare professionals in the state of New Jersey. That shortage is with us, and it is only going to grow. How can Virtua Health College, under your leadership, address that shortage and make sure there's a healthy pipeline for the future of this state?
Yeah, it is everyone's worry right now. So, and I'm going to add one more thing. I would also say researchers. You know, so I remember not too long ago the concept of having increasing our medical school class as an example was maybe a little concerning to a lot of people. And there's a lot behind it. There's resources that are needed, making sure we're getting the right students, et cetera. But what is our mission? And I mentioned a little bit earlier, I'm going to add another one. And this is critical for everyone to hear this, because I would put it on a t-shirt, I may. But hospitals, communities, universities, colleges, I'm even going to say governments, that don't address the needs of the community that they're in will cease to exist. Let me say it again. If we don't address the needs of our community, we will cease to exist. I believe that wholeheartedly. I've seen it over and over and again in my career. And what are the needs of our community right now? Healthcare providers, researchers, increasing research that's quality. So that's a big task, right? So when we talk about, you know, how do we do that, right? Yes, we increase class size. We started a PA school. We could have been fat and happy and spur our medical school. Why do we need a PA school? Because our community needs it, right? We can't hide under a rock and pretend that that is not a need of the community. It absolutely is, and we need to embrace it, right? Nursing degrees, give them opportunities to start, get into working, get an RN, now an RN to BSN. Now we're going to start a doctoral program in nursing, and there's no end to where we're going to go with that. Why are we going to do it? Because it needs the community. That's our goal. That's why we exist. That's why doctors are here at the end of the day to take care of patients. That's why PAs are here. That's why nurses are here. And the scientists are there to help us do it, and do it with good science, right? That I wholeheartedly agree. So now we're going to start building allied health professions, right? So because we need to. It is our mission. So that's what we're going to do.
And on that note, the partnership between Rowan University and Virtua Health continues to grow and has led to fantastic opportunities for schools for students in all three schools. How will you continue to leverage that partnership and all of the great things it's brought to enhance both the quality of the education and the delivery of healthcare in this region?
So, I mean, first of all, we partner with the largest delivery of healthcare in the region. And we're going to continue to leverage that and work with our chief affiliate partner. That's who they are. I would also say it's as important that we continue working with our other hospital partners, right, which actually help move our mission forward. We can't do it without all of our hospital partners working together. And I think it's important for the viewers that are listening to know that we have partners throughout the entire state of New Jersey, in Delaware, in Pennsylvania, and Gulf, even New York. Right, and you know, I feel that Virtua and the resources that they've allowed us to do, especially in research, right, has been transformational for Virtua Health College. Transformational, as we're building a research tower, right, and talking about putting the patient in the center of research. Years ago, actually not too many years ago, people thought about bench that maybe would get into the bedside, right? Our mantra is bedside, bench, back to bedside. That's how we're thinking about developing and growing our partners. And as we develop these research centers now that we're doing with Virtua Health College, that's how our mindset is going to how do we focus putting that patient in the center, right? And that's what we're going to train our students. Patients should be in the center of all that we do. And like a university, the student is the center of all we do. So they've been transformational and allowed us to do this great work. but so has many of our other partners that have allowed us to continue to do our outreach programs. And we're just beginning, Jonathan. I'm telling you, we're just beginning on that. We're state partners, tri-state partners, international partners. That's what we're talking about right now when we look to the future. Who can we partner with, not only in the US, but beyond, who have the shared mission that want to see us, and what can we do on a global level? That's where we're going.
So you have been the Dean of SOM for quite a while, a position with plenty of pressure. But now, there's obviously going to be some added stress and pressure when you become the Vice Chancellor of 3 schools. How do you, on a lighter note, how do you deal with that stress? What are your hobbies? What are your kind of leisure activities that let you take a break, reset, and take care of your own mental health?
Like when we're done this interview, what am I going to do right after this, right?
Yeah, immediately.
So those, many of you know, I do research in addiction, right? So I'm a big believer in, dopamine in the brain and what can you do? And we can do these things ourselves, by the way, to improve dopamine, right? Especially after going through an event that depletes dopamine, right? Like maybe this interview. So so my favorite thing to do every single day, my entire staff knows this, and they'll just see me kind of just walking out here, I talk to a student. I do it, and the students, they're like, oh, we love that the dean comes and talks to us. But the reality is I don't do it for them. I do it for me, right? And so nothing fills me up, my brain, with dopamine quicker than being able to go out and just talking to students and realizing, and I can just go up to a student, I could tell what kind of day they're having, just by looking at them. And it reminds me that no matter how much you're struggling right now and maybe having maybe a difficult day, and in this role as dean and as vice chancellor, you can have some pretty tough days. Someone's having a worse day than me. And the ability to go out and recognize, are you okay? Or just asking that question to me is what I need, not what I can do, what actually I need to do. And they literally put in student breaks in there, like just you go play with students. They literally just go and talk to some students right now, because I need that. That's how I replenish myself. If people ask me all the time, if you're gonna sit at tables or whatever, like where do you want to be? I'm like, wherever the students are, right? I learn from them. They motivate me. They're my biggest motivator, by far, are my students, right? And the day I can't be around them is the day that I'm going to move on from this role. Maybe did that answer the question, or?
I think it did answer the question, yes. I think it answered it very well. So we've spoken about our current researchers, clinicians, our current students, and how much you love spending time with them. Let's wrap this up with a message to our prospective students. What do you say to the prospective VHC student, whether they're a future physician, PA, respiratory therapist, a nurse, or any of the allied health professions that we educate?
You're coming to the best school on the globe, by far, by far. If everything we talked about mission, about being on the forefront of caring for people that are underserved, we're your school. No one's going to come close. You're entering the most quickly growing, dynamic school on the globe. You have the best faculty and staff that support you. When you look around here and you walk the hallways here, you see people smile. Everywhere, they smile. They smile because I believe this. People come to work, to school, because something bigger than a degree or a paycheck. People come here because they want to be part of something bigger. They want to be part of something that resonates with them. Resonates with them. And for me, it's always the mission. So if that's who you are, and this is what you want to be, then there's no other school. It's us. Simple. Period. It's us. And we'll get you everywhere you need to be. That, no doubt about. You'll get into the career that you want. You're going to be well trained. Quite frankly, we do that well. But it's bigger than that. It's about, where's your legacy going to be? Where are you going to say, this is where I went? Right? This is the school I went to. And at the end of the day, that's it. This is the school you want to be at. And we want you for that reason.
Thank you so much.
Thank
I think
you.
that concludes our interview.
Yep. Can I say one more thing?
You sure can.
Go Birds.